Hi guys, once again Ijaz Hidayat is with you with the new talk and with new discussion. Today we're going to talk about some medications used by the perfusionists during cardiopulmonary bypass. As you know, for the bypass surgery, you need to cannulate the patients, and we switch the systemic circulation into the artificial systemic circulations from the pulsatile flow into the non-pulsatile flow. As you know, when we want to go in the bypass surgery, and we use the heart lung machines, and by replacing the function of the heart and the lungs, so we switch the pulsatility of the circulation into the non-pulsatile flow, like a continuous flow. And there is a big chance of, once the systemic blood going to diluted with the crystallite, there is a big chance of hypotension. So hypotensions can be treated either by increasing your flow, like to achieve a full flow during the cardiopulmonary bypass. But in case if you're still not achieving your the target or the goal, as the target and the goal of our perfusion is to keep the mean arterial pressures above than the 60 and in around 62 into 80. To maintain these pressures, first of all, try to manage the flow with manage the pressure with your flow. But if you are not capable, or you're not able to achieve flow by achieving your full, you're not achieving your pressure by achieving your full flow, then we need to use some medications, like the most common medication used during cardiopulmonary bypass to prevent the hypotension is the phenylephrine. So today we're going to talk about what is phenylephrine. Phenylephrine is the alpha receptor drug, and is used as a vasoconstrictor. So how we're going to use the phenylephrine. So phenylephrine drug normally you get in 10 milligram in vial. So 10 milli the phenylephrine drug, usually you will get 10 milligram in 1 ml. So you will find a ampule with only 1 ml, which is containing 10 milligram of the phenylephrine, guys. So 1 milligram is equal to 1000 micrograms. So keep it in your mind. 1 milligram is equal to 1000 micrograms. So we having the 10 milligrams. So 10 milligram is equal to 10,000 micrograms. So recommendation dose for our experience is we are using like 100 micrograms as a small dose to keep the pressures like 60s and in between 70. So what we have to do, so we take 100 milligram of so you have to take 10 milligrams of the phenylephrine vial containing only 1 ml. So going to be diluted with the 100 ml of the distilled water, or you can use the normal saline. So once you're going to dilute it, this 10 milligram, which is equivalent to like a 10,000 microgram in the 100 mils of the distilled water, or you can use the normal salines. So it will convert into the 100 microgram per mils. So once you prepare your phenylephrine, so you can take 20 cc's of from your tiki pack, which is containing 100 mics per mils. So you can give the small shots like within 20 to 30 seconds of the 100 microgram of the phenylephrine to maintain your perfusion pressures. So guys, always keep in your mind, don't use excessive phenylephrine. So that by using the more phenylephrines, there is a chance of more vasoconstrictions, and you're going to be shut down your kidney functions, and it can be affect your kidneys. So what you have to do, first of all, try to manage your perfusion pressures with your pump flow, But if you're not capable to maintain the pressures like in a 60 to 70 millimeter per mercury mean pressures of the perfusion through the bypass surgery, you can use the vasoconstrictors like phenylephrines. So phenylephrines, different center have their different protocols to use the phenylephrines in my centers. The best and easy way is take a vial of the phenylephrines, check the expiry date of the phenylephrines vial, and then confirm is this is the phenylephrine ampoule or not, which is confirmed this is the phenylephrines. Just take 10 milligrams of the phenyl, which is only 1 ml, going to dilute it with the 100 ml of the normal saline, or you can use the distilled water, which is going to be change the concentrations and become now 100 mic per mils. Or some centers use like more doses, so you can dilute it into the 50 mils of tiki pack of the normal salines, and you can dilute the 10 milligram of the phenylephrine ampoule into the 50, so it will going to be a double, so it will be a 200 microgram per mils. So the recommendation standard concentration is 200 microgram per mils, and it can be maximums like 400 microgram per mils. But as per my experience of the perfusions, like 20 years, the ideal concentration during the cardiopulmonary bypass, especially in a during when you're using the heart lung machine and the patient's on a bypass, so the ideal concentrations for the perfusionist is 100 microgram per mils. But if still you are not able to manage the pressure, then you can use the alternative like a norepinephrine and phenylephrine. Then you have to concern with your anesthesia team, and they will guide you better. But as the standard for the usage of the phenylephrine for the perfusionist, the standard concentrations for usages of the phenyl during the bypass surgery is 100 microgram per ml. So you can use the small shots if the usages of your phenyl is exceed more than like a 500 microgram within half an hour. Then you have to concern and you have to communicate with the anesthetist, the cardiac anesthetist, and try to manage with alternate drugs to maintain your perfusion of the body during the bypass surgery. Hope it is clear to you. Have a nice and good day. Take care. Bye bye.